Welcome back. In this morning's Woman's Doctor, you may have had your tonsils removed when you were young, but when is it time for your children to get theirs out? Mercy Medical Center Dr. Emily Wisniewski says there are two major reasons why it might be time for surgery, and she joins us now with more. Good morning.
Good morning. How are you?
I'm doing well. So when we talk about the tonsils, there could be signs that it's time to get those tonsils out. What are some of those signs we should be looking out for?
Yeah, so the big thing I tell my patients when they come into the office asking about their tonsils and whether they need to be removed, there's usually two indications. One, you're having recurrent bacterial infections, like recurrent strep throat. And the reason behind that is just you're missing usually for the younger kids, you're missing so much school, you're on chronic antibiotics. None of that's good for anybody. And then the other thing to think about when you're getting your tonsils removed is if you have something called sleep apnea. And the reason why we care about that so much is because you're having periods of time at night where you're not oxygenating your brain. So we do take out the tonsils to help kind of control those symptoms.
And so how do you know, like if one of the signs is your child not sleeping right, how do you know whether it's sleep apnea or the tonsils, or is it just a combination of them also being sick?
Great question. So things to look out for that might be a sign of sleep apnea is you have a kid who not only is snoring, but you're noticing that they're having pauses in their breathing. Younger children can also sometimes be hyperactive, whereas our older children can sometimes wake up with morning headaches or have daytime sleepiness. So all of those things would be red flags that I would want you to talk to your pediatrician about to see if we need to get a sleep study.
And so getting the sleep study is a good thing. So are there any other signs to look out for as well?
In terms of sleep apnea, those are the major ones. The sleep study will kind of give us an idea about whether or not there are periods of time where we're not getting oxygen to the brain. In terms of the sore throat, it's really about how many infections that you're having per year. So usually if I'm having a child with 3 or more strep infections in a year, that's when I'll send them over to the ear, nose, and throat doctor for an evaluation.
And then when we think about getting your tonsils out, we've always seen you get all the ice cream you want after. Is that the right thing?
No, unfortunately, that's a lie. So ice cream can actually create a really thick layer on the back of the throat. And during the time when you're post-op and you're healing, we don't want that thick layer to be there because it'll cause us to clear our throat. So usually we look at things that are non-milk based, more like sorbets or gelatos.
All right, so popsicles it is. And then if you do get your tonsils out, what's the recovery time like?
Yeah, so kids are pretty resilient. Usually within a week or so, kids are back on their feet. We usually control their pain with Motrin or Tylenol, depending on their age, and just kind of let them rest up and hydrate up. But they should bounce back pretty quickly.
Awesome. Well, doctor, thank you so much for joining us this morning.
Thank you so much for having me.
Of course. And if you have any other questions or would like a referral, call 1-800-MD-MERCY.